lad, although born in England, but grew up in Melbourne, went to the University of Melbourne, and first opened a general practice in Cranbourne in 1987 and moved to this particular site in 1993. So I've been here 26 years, and I always had the vision for developing a multidisciplinary healthcare facility in North Cranbourne, and it was an area that I was comfortable with. It was a mortgage belt area that similar to the one that I grew up in, and over the 26 years we've gradually built on to the original building such that we have about 1,400 square metres under the roof line and a lot of car parking as well, and the facilities and services that we provide are fairly all-encompassing. There's a large general practice area with 12 or 13 doctors, an emergency room, a 5-bed emergency room that sees 400 people a month for lacerations, minor fractures, wound care, illness and the like. We have allied health here that deals with physiotherapy, podiatry, diabetic education, dietitian, psychology, audiology and a large dental practice. We have a specialist a set of specialist consulting rooms that have 15 different specialists of varying specialties. We have radiology on site that does simple and complex radiology, from plain X-ray, ultrasound, musculoskeletal ultrasound, CT and CT with contrast, pathology operations on site, and a pharmacy as well. So it's a one-stop shop. So successful over these years for two main reasons. One, because the area is growing incredibly fast. We've been in the top 10 growing shires in the country over the last 25 years. As well as that, the location that the clinic is. It's across the road from Bunnings, across the road from Woolworths, in the fastest growing area of one of the fastest growing shires in the country. The area is projected to grow 60% residentially over the next 20 years, making it larger than Canberra. And as well as that, not to be forgotten, is the industrial growth in the area. So light industry is filling this area, and we manage a lot of industrial clients as well here. So in short, it's those two main reasons. Growth in the area, residential, industrial, as well as position, our location within the area. I think that's part of the same. I think the growth in the area is extraordinary. We have 340,000 people in the city of Casey, and going to add more than 200,000 people over the next 20 years. The residential and industrial growth right here in this part of North Cranbourne is explosive, and I plan on being here for the next 30 years. So we have position, we have growth, and we have a steadiness. Part of the reason that I'm planning to stay that length of time is the foundation that I've established, the ACE Foundation, in this area. We assist children in the city of Casey overcoming challenges in their educational pursuits. It's extremely important to me, and I plan for it to grow and grow over the next 30 years as the centre does. There was a time, Marcello, about 25 or 26 years ago when I was a little bit nervous about other centres setting up, and we've now had 26 years of continual growth, year-on-year growth, with 15 or 20 medical centres setting up. Not only do they not impact the growth that we have, given that we have between 60 and 120 general practice new patients every week, not only do they not affect our growth, but they actually feed into the centre, to the facilities that we have, to the allied health and specialist facilities, to the emergency room and after hours facilities. So the short answer to your question is no, they don't eat into us, they actually add to us.